Sorry, I couldn't get on, and I'm on a different computer, but I'm on now. So
it's great. The important thing is that you're here now. And are we all ready to go live in 2 minutes?
I'm ready.
I want to see
lighting okay? My video okay? If I'm ready to go.
Yeah.
Mayor, you have your script in front of you?
Yep.
Okay.
Okay, perfect. Okay, good luck to everyone. Enjoy the conversation. And we will be live at 6:32. Mukala, when it's 6:32, try to count like at least until 30 to welcome everyone. Okay.
Okay.
Good luck again.
Thank you.
Thank you.
All right. Good evening, ladies and gentlemen, and welcome to the virtual town hall. My name is Mukala Kabongo. I will be moderating this event. In a moment, we will hear from Mayor Tom Mcgee, Lynn Public Health Director Michelle Desmarais, and local medical experts from our partners at Lynn Community Health Center and Mass General Brigham Salem Hospital, who will share information about the ongoing COVID-19 pandemic, COVID vaccine safety and efficiency, local efforts to vaccine members of the general public, the continued importance of COVID-19 testing, group gatherings, and compliance with the state guidelines. We are also offering a Spanish-only town hall tomorrow evening, May 6th at 6:30 p.m. for those who are interested in viewing this in Spanish only. This is an interactive forum, and we would love to hear from you. We will be taking questions from viewers in the second half of this town hall, and those questions can be submitted through the Zoom chat function at any time during the event. Also, we may not be able to get through every question. We may not be able to get to every question, but we'll try our best. Now, I would like to welcome our Mayor, Tom Mcgee, to say a few words. Mayor Mcgee.
Thank you, Mukala. Hello and good evening, everyone. And thank you for joining us this evening for this town hall. The goal of this event is to provide you with helpful information and to answer your questions pertaining to the topics that affected each and every one of us for the past 14 months. COVID-19 has truly changed the way we live, work, and play. It is so incredibly important that we continue to take it seriously for the health and well-being of yourself and of our community. Our goal since the COVID-19 vaccine became available has always been to make vaccinations as accessible as possible with a multi-pronged team approach. Opening up the Lynn Tech vaccination site, a venture between the City of Lynn and the Lynn Community Health Center. That is up to 6,000 vaccinations, a combination of first and second doses a week that are available at that location. While we have additional capacity at Tech, we have decided to open up eligibility there to people who live outside of Lynn, to include all Massachusetts residents. Initially, only those people with an appointment were able to receive a vaccine. However, today, we are now allowing walk-ins at the Lynn Tech Fieldhouse vaccination site. That's a big step forward. Walk-ins are now available. Conducting vaccinations at our senior and affordable housing buildings, holding designated clinics for our first responders, educators, and essential workers. We have also vaccinated a number of our homebound residents before the state launched their homebound program. and a mobile vaccination operation through partnership with the Lynn Department of Public Health, Lynn Community Health Center, Mass General Brigham, with the goal to meet people where they are in order to reduce barriers to vaccination to our hardest hit to reach communities. Thanks to our strong partnership between the city, the health center, and MGB, we're also able to launch a call center for Lynn people who do not have access to the internet or have trouble navigating the internet. This is also the best way for people who are trying to schedule appointments for 16-year-olds who specifically need the Pfizer vaccine. The phone number is 781-595-7747. We have had great success thus far with our vaccination efforts, with so many people collaborating and coming together to make it work. The latest state data shows that as of April 29th, 31,381 Lynn residents are fully vaccinated and 13,282 are partially vaccinated. Overall, 44% of the Lynn population has received their first dose of either Pfizer or Moderna vaccines, or the single dose of the Johnson & Johnson vaccine. While we have seen good numbers of residents who have been vaccinated to date, we also continue to see positive COVID-19 test results as well, which means that the virus is still out in our community. People need to continue to be tested, and we have a ways to go. I'm glad to be here tonight to have this discussion to continue the success we've started and to build on that success. Thank you again, Mukala, and the community.
Thank you, Miriam Newman, for those remarks. And now we will meet our panel. First, we'll start with Lynn Public Health Director, Michelle Damaris.
Good evening, everybody. I'm Michelle Damaris, Public Health Director, City of Lynn. It's my pleasure to be with you tonight. I hope you find this to be a very informative teletown hall. And if you have any questions, please feel free to make sure that you write them in the chat box so that we can get to as many as we can. I'd also like to remind you that vaccinations in Lynn are very, very important to continue. If you have questions or you feel uneasy about them, I hope that you will call the health department at 781-598-4000 so that we can help try to answer and alleviate your fears of the vaccine. Thank you.
Thank you, Michelle. Next is Dr. Barbara Lambert.
Hello, everybody. Thank you very much for inviting me to your town hall here. It is an honor to be here. I have worked in Lynn at the Lynn Union Hospital for 12 years before the hospital merged with Salem Hospital in Salem. Currently, I'm the Senior Infectious Disease Specialist at Salem Hospital, and I'm also the former hospital epidemiologist there. So I'm really looking forward to your questions. Please feel free to send them in our chat box, and we hope we can answer most of your questions.
Thank you, Dr. Lambert. Next up is Dr. Miriam Newman, who likes to go by Mimi.
Yes, Dr. Miriam Newman. Again, thank you so much for including me. I am president of the medical staff at what is now Mass General Brigham Salem Hospital, but like Dr. Lambert, worked at Lynn Union Hospital for over 10 years prior to that. I'm hoping that we can share some of our learning and our confidence in the vaccine and how effective it is. I'm happy to report that almost 78% of our staff across all levels of the hospital are now fully vaccinated. So again, hopefully that is a measure of confidence, and we're eager to answer questions and try to spread some of that knowledge. Thanks for having me.
Thank you, Dr. Newman. Now we have Dr. Hannah Haptu.
Good evening. Thank you again for inviting me to participate in this important program. So I am an infectious disease specialist, and I have been at Lynn Community Health Center for the past over 20 years right now. Initially as a primary care for quite some time, but I do specifically infectious diseases, and it's been quite a pleasure taking care of Lynn residents, and I'm happy to answer questions.
And last but not least, we have Marita Gold.
Hi, everyone. I'm Thank you so much again, as everyone has said, for the invitation. My name is Marita Gove. I'm a family nurse practitioner in what we call normal times. I'm actually the nurse practitioner at Lynn English High School, so I might have met some of you or met your kids throughout the years at Lynn English. And then since school is closed, I've transitioned into a role more around COVID and specifically as the clinical lead for our vaccination program through Lynn Community Health Center. Thank you.
Thank you all, and let's get this going. Let's get started with this great discussion that we are going to have. First, I'll generate this question to Michelle and Marita. Is it still necessary to get tested, and if so, when?
Hi, everybody. It's Michelle. I do think that it is still necessary, especially if you are not vaccinated. And if you are in, for instance, if you're back in school and if you aren't feeling well, I think you should get tested. If you are playing youth sports and you're not feeling well and on a team, I do think you should get tested. Testing is still the most important means that we have to try to mitigate this disease. Testing is available at Lynn Community Health Center and at the Project Beacon site, which is on the Lynnway, down by where the old ferry was in Lynn. And I'll let Marita continue.
Thank you. Yes, definitely. So testing is very accessible in Lynn, both at Project Beacon and at Lynn Community Health Center. And just as an FYI, if people don't already know it, testing is free and is open to all residents, regardless of insurance status. And yes, testing is still very important, particularly if you've had an exposure to someone who you know has tested positive, or if you have symptoms. We know that COVID vaccination is incredibly effective, but we still need to be really cautious and test if we've been in contact with someone or have any symptoms of COVID as soon as possible to make sure that we can reduce the spread to others.
And there's so many people are still so concerned about how effective the vaccines are, the safety of the vaccines. For our three doctors here, can you guys just speak on the safety-ness, the importance of the vaccine and how safe it is and how effective it is, because so many people still have these worries about it being safe and side effects? We can start with Dr. Newman.
Okay, trying to be polite. Yeah, so I think in terms of effectiveness, there are multiple studies that have shown, numbers, upwards of 90%, 95%, which is really unprecedented for any vaccine. And so we should all seek a lot of comfort and reassurance from the effectiveness. Now, as Marita just said, it's not 100%. So there will be breakthrough cases. But what's really sort of important about that is that the expectation is that will be mild illness. So the effectiveness in reducing hospitalizations, which is really where we were hit so bad and we lost so many people to death, that the failures are really different. And so preventing hospitalizations and death is still incredibly high. But even the mild illness, again, breakthroughs of 5%. In terms of the safety is, I think, the second part of your question, Mukala. The safety data is incredibly strong as well. There have been some reports of allergic reactions. Again, everyone has recovered. There's been no death from that. When you compare that to the death of COVID, there's no comparison. And even the J&J vaccine, which is really a great option in that it's easy to keep. It's one dose. You don't need follow-up. The safety record for J&J, again, there was a pause, but that quickly went right back on, became available because the data showed that there were maybe, less than 15 cases of a serious side effect out of 7 million doses. So again, it is incredibly safe. And especially when you think about how devastating COVID can be. And I invite my other professional doctors to chime in as well.
Dr. Hopkins could chime in with your...
You're muted, Dr. Haptu.
So yes, in terms of efficacy, the reason that the reported or new infection rates are low in Massachusetts is because the high rate of vaccination in the population. We have close to 4 million people at least gotten the first shot. And so that tells you that the more people that there are vaccinated, that the less spread that would happen. And therefore probably get that what they call herd immunity, to where we may even actually get rid of the virus at that time. And so it is very effective and very successful. And that's why we all need to be vaccinated.
And Dr. Lambert, what if if a person is pregnant, or should they have, and they have concerns about this? What advice, or what are some things that they should know about the vaccines?
That's a really important question for young women. But before I answer that particular question, I want to go back and reemphasize something that my colleagues, Dr. Haptu and Dr. Mimi, mentioned, how safe this vaccine is. When you think about, in the United States, we've now vaccinated about almost 50% of our population, 150 million people have been vaccinated, and we've had very few deaths from the vaccine itself. So for instance, the clots that you've been hearing about from the J&J vaccine, only 2 out of 1 million people have a risk of death from the J&J vaccine. And remember that COVID virus itself causes clots in the lungs, in the legs, even in the brain. And the chance of dying from COVID is 3 to 4 out of 100. So the chance of getting a severe illness from COVID-19 is 3 to 4 out of 100, as compared to 2 out of 1 million if you get vaccinated. So I think that's very reassuring, and we have lots and lots of scientific data. The CDC is still collecting data on adverse reactions through their vaccine monitoring program called VAERS. Now, to get back to Mukala's question about pregnancy, it's interesting, in the studies that were done from Pfizer and Moderna, pregnant women were excluded from the studies, but there were about 100 women who signed up for the study not realizing that they were already pregnant. And what they found was that there was no increase at all in miscarriages or premature babies born. And currently in the United States, there are over 100,000 pregnant women who have delivered babies. And again, we've seen no increased risk. And so this is important because we know that COVID itself causes a worse disease in pregnancy, and you can risk losing your baby if you get the virus itself. So the vaccine will actually protect the mother and protect the baby, as well as the baby benefits from the mother's immune system.
Marita, Michelle, I don't know if you would know this, but were there any instances in Lynn when people getting their vaccine? Was there any instances with any pregnant women that came to get vaccines, and any effects from that, or did you hear of anything?
So we've had a number of pregnant women get vaccinated at the mass vaccination site at Lynn Tech with great success. No adverse effects that I'm aware of. I know our OB department at Lynn Community Health Center is really encouraging their pregnant patients to be vaccinated, as I know just providers are in general, because of all the risks in pregnancy. And so we've had a lot of pregnant women coming through, lots with questions, which we're happy to answer at any point. Coming to the site doesn't mean you're promising to get your vaccine that day. It can be an opportunity to ask questions too. But yeah, it's been great to see a lot of pregnant women coming through.
That is definitely great. And now, as we move forward, people get their vaccines. You know, they may have got their first dose, or they may have received their second dose, and then they're like, okay, things are back to normal for me. I can go out and do whatever I want. I could wear a mask. I could go into crowded places. But what do you usually recommend for folks that this could be for everyone? What do you recommend when folks do get fully vaccinated, and how should they go about their day to day?
So I'll say my 2 cents. I think that for everybody who is double vaccinated, don't forget it takes 2 weeks after you've been vaccinated for full immunity to be present. So once you get you get your first vaccine, you have to wait 2 weeks, and then you get your second one, and you have to wait 3 weeks in between Pfizer and 4 weeks in between Moderna. J&J is great because it's one shot, one-stop shopping, and you're all done. But just remember, it takes 2 weeks for immunity to work. I think that if you are with people who have been double vaccinated, especially with your family, that you can relax a little bit, take your mask off and enjoy your family company. I think that if you are if you're in a group with unvaccinated people, I still think it's important to keep your mask on.
Yeah, and I think the guidelines, I think this is challenging. It's challenging for the community because it's not going to be like a light switch that goes on and off. This is going to be a very gradual trying to get back to normal. And we've had such a difficult 14 months, all of us, of being restricted, of being quarantined, of wearing masks, of distancing. It's been so hard for all of us, and being apart from our loved ones. I think what's the gift of the vaccine is that we can just start to relax a little bit. And so, like Michelle said, if you're vaccinated, now you can be outside, and as long as you can socially distance, you don't have to wear a mask anymore. Now, if you're in a public event, in a large gathering, you don't know who's vaccinated, you don't know who isn't. And if you can't socially distance, you still need to wear a mask. But I think the gift of the vaccine is that we can start to reclaim our life a little bit and do it safely. But it's really only going to be most effective if everybody does it. And that's the challenge, right? Lynn is doing amazing, but you're still at 44%. We want to see the city of Lynn at 60, 70%. That's when we can start getting feeling that if there's one person, 1 or 2 out of a group of 10, it's not going to spread as fast. We're going to have more control. And I think the other issue with this, and the reason we can't fully relax is, there's still these other variants, right? And there is still some unknown. So there is a loosening, there's an ability to relax a little bit, to be with other vaccinated people and not wear masks, to be in your pods without masks, even to be outside without masks. But I think once you're getting up close with people that you don't know what their status is, you still need to do all the precautions. Because again, these other variants might be there, they spread, and we don't know if we're, even us vaccinated, could be transmitting disease unknowingly. And so we would hate to add and fuel the pandemic that way.
Dr. Lambert, has there been any instances where someone had COVID, beat COVID, received both vaccines, and got COVID again? Have you heard of anything like that, or is that even possible?
Mukala, that's a great question. Yes, there have been, but they're pretty rare. They're pretty rare. In fact, they're reportable cases. A lot has to do with travel and being exposed to these variants that Michelle talked about and that Mimi talked about. The vaccines in general, the vaccines that we have now, the Moderna and the Pfizer, are very effective against the United Kingdom variant, which is the most common variant right now in Massachusetts. In fact, I was reading that up to half of all the COVID cases in Massachusetts now are the United Kingdom variant. But the vaccines work against those variants. but people have gotten the virus after being vaccinated. As Dr. Haptu pointed out, it's not 100%. It's not 100% guarantee. And even if you don't get sick, you can carry the virus in your nasal passages and spread it without knowing, without having any symptoms to other people. That's how sneaky this virus is. And that's why we do say that there are 3 conditions under which even vaccinated people should continue to take precautions. And those are, number 1, if you're going indoors, if you're going to be in a poorly ventilated room, tight quarters, you should wear a mask, even though you've been vaccinated. Number 2, if you're going to be in a very large crowd of strangers that you don't know what their vaccine status is, say you go to a ball game, say you go to a Red Sox game or a Patriots game, you really, even though you're vaccinated, you'd be smart to wear a mask because you might be exposed to somebody with a variant virus and you could start carrying it and spreading it. And then the third thing is, of course, if you're with a lot of strangers and you don't know what their vaccine status is, we are recommending that even though you're vaccinated, still take your precautions. Be cautious. Be cautious. It's not a get out of jail free card.
I just want to add something. The mask has to be well fitted. It has to be a well fitted mask. And as everybody's saying that, I mean, if there's a huge gathering, just avoid it, you know. We should still keep our guards on because there are a lot of people unvaccinated, and we can get also the, reinfection with the after the full vaccine. And so, and it is that when many people are not vaccinated and the virus lingers, that's when these variants come up. And that's why the reason that, we also try to do the best that we can to wear the mask whenever we have to, regardless of our vaccination, and try to, advise or persuade people to being vaccinated.
This one's for everybody. What do you usually tell your patients that have received their vaccines as far as follow-up, as far as following up, after they've received one or both of the, after they've been fully vaccinated? What is some advice that you give your patients or the people that come to see you?
So most of the time, after I'm sure there's information that are given at the vaccine side, what kind of side effects to expect. And these are really mild side effects. They could be body aches. It could be definitely injection site, pain or swelling sometimes, even redness sometimes. And a fever, some people may have headaches, but these last, 1 to 3 days, at the most 2 days. And, just if you have that, just take Tylenol, ibuprofen, and you can rest. And people usually recover immediately. I mean, after I took my second shot, I felt like not myself, and I was having pain, and there was like, within the next day it was all gone, so it just disappears immediately. And so, these vaccines are easier. I mean, these side effects are easier. I have not seen any anaphylaxis so far. I'm sure Merida can talk. The only thing that we had some side effects, they say, was basically people were dehydrated, where they didn't drink, then they had vasovagal, what you call it, like they pass out or they faint. And usually it's not really it's just a reaction sometimes that happens, not really a side effect of the vaccine. And we have not seen any anaphylactic reactions at all. And those are the worst ones that you talk about. But then if we talk about the J&J, I'm sure, as Dr. Newman said, we have also information about those few cases of clotting with low platelets that had been an issue for it. But when you compare the risk versus the benefit outweighs just dramatically.
So what I tell my patients after they get vaccinated is that for 2 weeks they still need to be careful. They still need to take all the precautions because their immune system really doesn't kick in and fire up those antibodies until 2 weeks after the second, after the booster shot, the second shot for the Moderna and the Pfizer. And the same is true after the first shot of the J&J. So I do warn them, don't put your guard down. Don't let your guard down too soon.
I think another thing that's really important that I usually talk with my patients about since they're younger is that the vaccines are currently only approved for age 16 and up. And we are hoping to get approval, sounds like for Pfizer for age 12 and up, hopefully next week. But it is important to keep in mind, and I know I keep it in mind in my household, that mom and dad might be fully vaccinated, which is fantastic, but the kids might not be. And although we know COVID does have much more of a mild effect on kids, it still can spread substantially. And we just reopened schools. We want to be able to keep them open and get to the point where we can reopen even more normally in the fall. So I think it is really important to keep in mind that everybody's doing a great job at getting adults vaccinated, but we still do have a little way to go with kids, and to still be cautious about what they're doing as well.
Are we ready for some questions? You guys ready for some questions? All right, we have a question here from Andrea Gail Bennett. The question is, my understanding is the vaccine protects from severe illness, but does not protect from contacting COVID. Is that true? You want to take it?
Well, I think we've alluded to this a little bit, that there's two parts of the vaccine. One, it's not 100%, so you can still actually get COVID, mild COVID, but you could also be a carrier. You can be an asymptomatic carrier. We don't really know. I don't know if Dr. Lambert or Marita or Dr. Haptu have statistics on this, or whether it's been studied, but you can still be, you're potentially a vector. And so that's the concern. So I can't remember how Andrea phrased the question exactly, but again, the likelihood of severe illness and hospitalization, very low. The likelihood of COVID at all, very low. It's a 95% effective vaccine. But, can the virus be living in your nares, and could you be breathing it, exhaling it, and transmitting it to someone else? It's very possible. That's sort of the working assumption of why we want to still be careful around unvaccinated people, ourselves as transmitters of disease, vaccinated people as being a vector of disease.
If I could just make a point, because it's something I read, and I think the studies continue, I think it's a really important point that getting the vaccination doesn't mean that you can't spread it. But I think there was a number, over 2 million fully vaccinated in Massachusetts. About 1,750 had contracted COVID, which was 0.001%. I think most of those were even asymptomatic. So you can get it, but I think, at least from what I read in that story, and maybe the doctors can speak to that, we do want to be really careful about doing what we should be doing. But if you do contract it, it's either you're slightly sick, or you may not even be showing symptoms. So the vaccination clearly protects you. That data, as it evolves, continues to show how important it is, how safe it is, and what it's doing. Obviously, the ability to spread it is still kind of being evolving in terms of that data coming out. But I don't know if anyone wants to speak to that. I thought it was a really interesting story in the Globe the other day as this data starts to come out, and how successful, I guess the story is, how successful the full vaccination is.
Sorry. Yeah, go ahead, Barbara. Yeah.
Yeah, no, I was just going to reiterate what the mayor said, is that the studies are still ongoing for Pfizer, Moderna, and J&J, where they're actually looking at people who might have gotten the virus from a vaccinated person to see whether there is we don't have all the answers yet. We don't have all the answers for COVID. It keeps changing. It keeps shape shifting on us. And so there are still a lot of studies that are going on and answers still coming out.
But the one thing I just wanted to emphasize, because I think when I think about my loved ones and my family, the thing that's most reassuring is this idea of really severe illness, being able of knowing that, the earliest data where the hospitalization is going down, even as COVID rates might have gone up. And that's because, again, younger people were vaccinated later, the elderly, the more frail were vaccinated first, for that exact reason, for that strategy, to keep the ICUs empty, to have enough ventilators, to keep people alive. And so it's a good news story, but it's only as effective as getting to that herd immunity, which is why we're all here, to try to, convince people that yes, things are much better, but if there are variants and if we're not, at an adequate rate, we're still going to put our unvaccinated elderly or immunocompromised loved ones at risk. And we can see what's happened around the world around that, places that had COVID under control, places like India and Brazil, who are now, suffering. It's devastating. So we don't want to get too comfortable, and we really need to just keep getting vaccinated. It's incredibly effective at the things we're talking about.
Definitely. Okay, next question. This one comes from Diane S. Moni. I hope I'm pronouncing her last name correctly. If not, sorry. She says, I know the number of cases of influenza are way down from previous years, and it's assumed masking is responsible for the lower number of influenza cases. Do any of the panelists know if people with asthma are benefiting from masks, also from the decrease in influenza?
Yeah, I actually can take that one. I know from the pediatric perspective with patients at Lynn Community, we're seeing much better asthma control. I think there's a few things, right? It's lower cases of influenza and other, regular kind of common colds. Also, distance, right? So being more careful and cautious about being in large groups, which we know reduce that throughout the year anyways. But we are seeing actually folks doing a little bit better than other respiratory seasons. And so that is kind of a nice benefit of that. But I think the challenge is that we know that our folks with asthma struggled so much with COVID, right? And so it kind of is a toss-up in a sense, but extra important, particularly for people with respiratory problems, to get vaccinated as soon as possible for that reason too.
Thank you for the answer. Well, you got your response. Ma'am McGee, I think you probably would know the answer for this one. Mark Kellaway says he received his vaccine first and second at Melrose Wakefield Hospital, and he says as he lives in Lynn, is he included in Lynn's count for being fully vaccinated?
I think Michelle, you can speak to that, but that's part of the number for Lynn, correct?
Yes, it is. Every resident of Massachusetts, wherever you live, you're entered into the MIIS system, which is the general system, Massachusetts immunization something system. Sorry, I'm forgetting the I. But
information.
Thank you. the easy part. So you are, and it does tell as to where you live. So yes, even though you got it somewhere else, it does count for Lynn. Yes.
Great. Thank you, Michelle, for that. All right. Now we have one from an anonymous attendee. Question is, have you seen people not come back for a second dose? If so, why do people say it, or why do you think people aren't returning for their second dose?
Well, I'm not the doctor part, but I think that some people hadn't come back to the clinics that the Lynn Health Department had was due to the pause in the J&J. I think that's, made people just take a little bit more hesitancy and to just think about it. But I hope that people understand that it was just a pause. It was not a cancellation. It was not, stoppage. It was just a pause. And I can only just reemphasize and just try to tell you that it is important to get both. If you do Pfizer or Moderna, to make sure that you get both doses, just to make sure that you are fully, have full immunity with that. And I do still have faith in J&J, and I think that it's great for those who don't, some people don't like going to get needles and think, all right, I can only do it once and I'm going to go and get it. And I feel very strongly that all three vaccines, and as Dr. Fauci has told us, you take what you get. And I think that's the important part.
I just want to add something. I think the pause was very important. I think I'm glad they did that. But so it gave them a chance to really dig into the data and all the research to see that it is safe. And so that, and then maybe some people already had some hesitancy. And there's also some kind of, on the web about one shot may be adequate, like what they do in some, places in Europe. And so that might have also given some ideas on that. But I think that we know with one vaccine, people that got sick from COVID or got infected is between the 2 doses, basically because it's not fully or maximally, protected by just one vaccine. So it's very important to come back and get your second vaccines. If you still, I think even if there's no such thing as time has lapsed, we have other options.
Yeah, and if you miss your scheduled date for your second dose, what will be the regular timetable to go and get the second dose? And just reschedule?
Listen, you can get your second dose even 2 months, 3 months, even up to 6 months later. You just got to go and get it. That's the important thing, because the difference in the protection that you get from the second dose is enormous. So 1 dose protects you only 60%. Only 60% of people will be protected from a single dose. Once you get that booster dose, you're up to 95% of people will be protected. Mm-hmm. So in the J&J, where you don't need a booster, where it's not recommended at this time, the protection level is on the order of 90% after 1 dose, 89 to 90% to be exact. So the boost, it is really important to get the booster, and I'm not sure that people appreciate just how much more protection that buys you.
Mm-hmm.
Mukala, just to follow up on the second piece of that question, where can I get the shot, or how can I get it? I think that was the second piece of the question. Yeah. Again, as I said earlier, we have a mobile operation going. We have Lynn Tech working 6 days a week, and not only can anyone in Massachusetts show up and get online and get an appointment, but we actually started today walk-in. So if you had your first shot and you waited a month or 5 weeks, and now you're saying, okay, I want to get my second shot, you can actually show up at Lynn Tech. There are walk-ins available, so you can show up the days that we're open. The information is on the website, and as I said earlier, we'll get more information out. So make an appointment, connect with the mobile operation of the city, show up at Lynn Tech if you're free today or tomorrow, and you'll get that second shot. So there's many opportunities. I think the explanation why the second shot is really needed was great from Dr. Lambert, but I think it's what we're trying to emphasize is it's available. Appointments are available. You can come up and show up and get the vaccination, and we want everybody to take advantage of the hard work that's gone on to create the Lynn Tech site, the mobile operations in the community, to take advantage of it. Get yourself and your family vaccinated. It's easy, it's available, and you can get those. Early on it was tough to get an appointment. They're available when you need them, and you can make it happen tomorrow if you like.
The vaccine clinic is open till 7 or 8 p.m. Am I correct?
Marita, do you want to speak to the time on that, please?
Sure.
On the timing for when the tech operations open.
Yeah, so Monday through Thursday, Monday, Tuesday, Wednesday, Thursday, our last appointment is at 7:25 p.m. So we have 4 evenings. Friday, it is 4:25 p.m. And then Saturdays, we are open from 8:30 a.m. to 1:25 p.m. So the access is definitely varied, so that you can come before work, after work, on the weekends, depending upon what your schedule is. The other thing I did want to highlight is we've recently been able to start sharing which brands we're going to have which session on the website, which was a lot trickier to do initially, just because of supply was a little less predictable. But if you're curious, you can go on the scheduling website for Lynn Community Health Center to schedule a vaccine and actually see which is being offered. If you're in a situation where you are due for a dose 2 and maybe missed your follow-up appointment, the other option is to call the vaccine call center that Miriam Newman mentioned earlier, and they also have access to knowing which brand will have at which point. Because we are running all 3. I guess I should say that too. We do offer all 3 brands, but not at the same time because that's complicated. So we do offer Moderna, Pfizer, and Johnson & Johnson at Tech.
The city does have, I'm sorry, Mukala, the public health department also does have its own clinics. We call them our roadshows. so that we do go, like we have been to the senior housing in Lynn. So if you aren't able to get to tech, and if you want to call the Lynn Health Department, we're also able to assist you.
Great. Like, there's a lot of great information that was just shared. I think we alluded to this earlier, but maybe this person missed it. Washa Lu asks, how long does protection from the COVID-19 vaccine last?
That's $1 million question. So it's being studied. We don't know yet, but this is a new disease. It's a new vaccines. And so we need some time to get all the data to say for sure. And so no one knows yet, so.
Yeah, I think the verdict is still out. Clearly we all know that the flu vaccine, we do, once a year, we repeat. There's some speculation that, we might require boosters, but I don't think anyone knows the answer to that just yet, Mukala.
Yeah, understandable. We have a lot of great questions. Another question I was asked is, what made you get the vaccine? Was it your family? What you miss doing your daily life? For me personally, I got the vaccine because of my grandma. They told me, my family was threatening me to not let me see my grandma. So they said, if you don't get your shot, you can't be around your grandma. So I personally got it from my grandma.
Yeah, I have to tell you, I could not get the vaccine soon enough. I'm a hospital-based clinician. I do procedures, and we spend a lot of time in the intensive care, taking care, doing procedures on these really very sick people. And just the death and the sadness and, again, not to get so morbid, but I think that's what people really need to hear. It's a terrible way to die because you're dying alone. You can't be with family or friends. So the motivation for me was to start that process of not having to see that and experience that and have people lose their lives. But on a more personal level, like you, Mukala, it's that alienation from loved ones, right? Being afraid, coming home every day from the hospital and being afraid that I was going to cause illness to my children or my husband, not being able to see my 94-year-old father for over a year because I was afraid that I might transmit it to him. So I think the motivation was really the safety of the people I love around me, as well as, the broader community. It's really as simple as that. I think, we're lucky that some of that is now more of a faint memory, but it's not that far away. It was really devastating. And that's why we don't want to get too nonchalant about it. So again, sorry, it took a dark turn there, but that's what it is, the reality.
My motivation was my mother also, and my position trying to set an example to show you that the vaccine is safe to get, and to please get it because it helps protect all of us.
Yeah, I, really similarly, my initial motivation was because I just spent a lot of time in our urgent care in March, April, May, and June, seeing patients who we really couldn't do much for, truthfully, and watching them leave in an ambulance and not be able to go with a family member and not really know if they were going to come home from the hospital. And I think that was just really impactful. But also personally, my youngest was 10 months when this started, and now he's turning 2 next week, and he hasn't met a lot of our friends and family. And, suddenly you realize that especially for young people, that time has passed and, we've kind of lost it. And so it's exciting to think about getting it back soon.
My motivation, Mukala, was a little bit more selfish, actually. As an infectious disease physician, I take care of a lot of these patients, just like Dr. Haptu and Dr. Mimi. And so I was scared. And I signed up just as soon as I could. The supplies were still limited in January when I got my first shot. But boy, did I have a great sense of relief and just took a deep breath and exhaled once I got my shots because I knew I was protected. And then, then I could go visit my 97-year-old mother in the assisted living because I wasn't banished from the assisted living. So there were 2 reasons, really.
So for me also, as an infectious disease specialist, I see a lot of patients with HIV. They are immunocompromised, high-risk patients, and so that my job is to to protect them. That's my responsibility. And then of course my family. Of course I should be selfish. I want to be healthy. I mean, I don't want to get the disease or the infection and have any complications or whatever it is. And so I think it's a combination of a lot of things. But I think that if there is an alternative to that horrible thing we've been seeing at the beginning of the pandemic, especially in New York, was that who wouldn't want to be vaccinated really? And so that was the reason for me.
I'll speak to my motivation, obviously for family and ensuring that we're all safe, sending a message of the safety of it. I turned 65, and when that age group was available, I got my appointment and got vaccinated. But I think being close to the everyday, and everyone on this call has been close to it, but the devastation in our community, 216 people have died in Lynn. We've had over 17,500 cases, and seeing the devastation that this pandemic and this COVID has impacted the city of Lynn, and just trying to be part of the direction to go forward is getting vaccinated, understanding the safety, the effectiveness of it, and how we're going to move forward as a community together is by getting ourselves vaccinated. And so it really is, it's for our family, it's for our community, it's for all of us, I think, to understand that this is our way forward after we've sacrificed so much in terms of family, the sickness in our community, businesses impacted. So all of those pieces are part of it. And I just want to be clear, I've had both my vaccinations. I didn't really have any side effects from it. My wife has got her 2 vaccinations. My children have, because of their ages, have both gotten their first vaccinations. We feel confident in getting the vaccination, and we've been really happy to know that it's available to everyone. And I guess that's the strongest message. Why I wanted to do it, but more importantly, we want to make sure that everyone in our community together helps us get everyone vaccinated. That's what tonight's all about. And it's about the safety and bettering all of us as a community together.
Great. And these are our last 2 questions because we've been having so much fun that the time just flies by so quickly. This has been so great. So these last 2 questions, they kind of go together. All right. First one is, do people need to bring vaccine cards for the second dose?
Yes, very important. Yes. It's important so that we can keep track of the lot numbers and exactly what vaccine you got. Because if you start with Pfizer, you need to finish with Pfizer. If you start with Moderna, you need to finish with Moderna. So, and it also gives the date, the lot number, and which vaccine that you did have. So yes, it is important. I carry mine with me all the time.
Awesome. Oh, there you go.
A quick follow-up to that. Maybe it wasn't asked, but what if someone has lost their card and weren't sure which vaccination they got? Would that be, what would they do at that point if they got one shot and didn't waited a while and then can't locate the card and weren't sure what they got?
Yeah, we are able to determine that. You can go into the MIS system and we are able to determine the date and what you got. So we are able to replace the card. Wherever you got your shot.
On a practical level, I've learned this around post office receipts and all kind of things. I recommend people just take a picture of their card before they lose it, after the first one and then after the second one, so that, everyone has a cell phone these days, or most people do. So if you think of it, take a picture of it. It's a little bit of advice.
Yeah, that's the best way to go.
I just wanted to add, so these vaccines that are entered into the MIAS, which is the Massachusetts Immunization Information System, that is available to your primary care's offices. They're able to get that information in the electronic medical record, and you could have that there.
Awesome. Thank you for those. All right, we're coming to a close, but before we get to the end of these closing remarks, I just would like to the panel to just give some last remarks before we close up shop.
Could I ask just one more if maybe Marita, when you speak, just to again give out the times and the days that the vaccine's available, and maybe Michelle, you can talk again about the options for the mobile opportunities. I just think to reiterate that might be helpful.
Sure,
All right.
definitely. Michelle, you go first.
Thank you. Thank you, everybody. And I hope you enjoyed tonight. It's very informative. It just goes to show you the importance of vaccine. And I think the more of us that get vaccine, it's the opportunity for us to move forward and to try to go back to some sense of normalcy. The mobile clinics, you can call the health department here at City Hall, 781-598-4000. And we are able to provide you with that. The other thing I would just like to remind everybody, for those of you who aren't eligible for a vaccine, is to remember to stop the spread with testing at Project Beacon down on the Linway. You can call them at 617-741-7310, or you can, the app that they have is app.beacontesting.com. Lynn Community Health Center also has testing available Monday, Wednesday, and Friday, 8:30 to 4:30, Tuesday, 8:30 to 7 p.m., and Thursday, 10 to 7 p.m. Thank you, everybody.
Laura Marita.
Perfect. So yes, thank you as well. I am at the Lynn Tech vaccine site every Tuesday from 8 a.m. to after 8 p.m. So I look forward to seeing many of you there. So just to review the hours, we are open at the Lynn Tech Fieldhouse. It's 80 Neptune Boulevard. Mondays, 8:30 to 7:25 is our last appointment. Tuesday is same, 8:30 to 7:25. Wednesday is also the same, 8:30 a.m. to 7:25. Thursdays, our first appointment is 1 p.m. to 7:25. Fridays, we are open 8:30 till 4:25. And then Saturdays, 8:30 till 1:25. And you can book an appointment on the Lynn Community Health Center website, which is lchcnet.org. There's a banner right up top for COVID-19 vaccination. And you can also call our COVID vaccine call center. Our Lynn Community Health Center main number also links to that. So you can also call the Lynn Community Health Center, and the first option is vaccines. That's number one. So lots of different ways. And as the mayor mentioned, we also started today with walk-ins. So if you lost all that, it went right past you, just walk in, show up at Lynn Tech Fieldhouse, and we'll help get you in.
Dr. Hoptu.
So just to add to what Marita is saying, we do have a mobile unit on Sundays. And so those of you organizations or communities that really would like to have us, come out there, please let us know at the health center. We are very ready and mobilized to, provide vaccines to whoever wants it or where it's necessary. So it's a robust program on Sundays, and so I just want to remind people that if you have any idea on that, you can talk to Michelle or just approach the Lynn Community Health Center. And so I'm really grateful that we are where we are at this time, where about 44% of our patients are vaccinated, and Lynn had such a heck of a time with this, with this infection, with this pandemic, and we lost quite a lot. And it's not only the loss, but the residual, what we call long COVID. These are people that have persistent or consistent, problems after they recover from their acute infections. They may not be able to walk. Some of them have heart problems, some have lung problems. There's just so many people with complications after they, got better from the infection. And you don't really have to be in a hospital or being intubated to have these complications. It's just a minor infection may lead into that consequences. And so it's not a good disease at all. It's, it's preventable, and thank God. And so I just, want to remind people, the more all of us we get vaccinated, the quicker we can go back to our lives after we, obtain the herd immunity. And thank you for listening.
Go to Dr. Newman, and then we'll wrap it up with Dr. Lambert.
So just very quickly, the message is really get vaccinated. Hopefully we've reassured you about the safety and the effectiveness, and this is our path back to normal, or as normal as it can be. When we think about the loss life, health, businesses, school. If we want to maintain all that, if we want our kids in school, if we want our businesses to thrive again, get vaccinated. And again, if you have any hesitancy after this, reach out to any one of us so we can answer your specific questions. But that's the path back to a life that we all want. Thank you for having me.
I want to thank the citizens of Lynn for asking these wonderful questions of us and making us think. My message is basically get your shots. You'll be so glad you did. Number one, you'll feel a huge sense of relief wash over you the minute you get it. And number two, you'll know you've done good by your community to build community immunity. Thank you,
McGee.
Mukala.
No problem.
Thank you, Mukala, and thank you all for joining us this evening. And I really want to thank the host and the guest panelists for taking the time to be here tonight, and for all the work you do each day keeping our community healthy and safe, especially this past year. Again, this has been a great discussion. Thank you so much for all you do, and thank you for being here tonight. To those who joined our town hall who may be watching the recording, I hope this was informative for you and your families on how safe and important it is to get vaccinated, as well as to continue to stay diligent and follow the guidelines to stop the spread of COVID-19 within the city of Lynn, within our community, within our greater community together. While we are seeing progress on the number of Lynn residents vaccinated, we are still experiencing double-digit numbers of new cases each day within our community. Now that eligibility is open to everyone 16 years and older, really, I implore all of you to do your part to keep yourself, your family, and our community safe. Make an appointment to be vaccinated right now. Together, we can really move forward, get past this together. So let's all get vaccinated. It's safe and effective, and it works. Lastly, please do not hesitate to contact my office with any questions or concerns by calling 781-586-6850 or emailing me at thomas.mcgee@lynnma.gov, G-O-V. That's thomas.mcgee@lynnma.gov. There are several other ways to stay informed and up to date on COVID-19. You can follow my Facebook page, Tom Mcgee, Mayor of Lynn. Visit the City of Lynn's COVID-19 resource page on our website. That's lynnma.gov/COVID-19/resources, or sign up for our Smart City 911 alert system by going to smart911.com. Not only is that great for the COVID-19, it gives you information and important emergency information from the city. You're informed, right up to date. We can get you that information immediately. Again, thank you for taking part in this virtual town hall. Stay diligent, stay healthy, stay safe, and join us all in getting vaccinated. Thank you for listening tonight.
Good night. Thank you.
Good night.
Good night.
House will be in order. On this matter, 160 members voted in the affirmative. A quorum is present. Report of the committee.
The Committee on Rules reports recommending that the following resolutions ought to be adopted. A resolution filed by Mr. Beal of Boston honoring Octavio Sululo, a multiple Purple Heart recipient, on his 100th birthday, and resolutions filed by Mr. Lombardo Billrica, recognizing May 1 to 7, 2021, as Elks National Youth Week.
Mr. Donato of Medford moves for suspension of the rules. Those in favor say aye. Opposed, no. The ayes have it. The rules are suspended.
Question comes on adoption of the resolutions.
Question comes on adoption of the resolutions. All those in favor say aye. Opposed, no. The ayes have it. The resolutions are adopted. House will be in a brief recess.
Objections to proceeding with the orders of the day?
Are there any objections to proceeding with the orders of the day? Chairs, none. Calendar item number 9. Question comes on ordering the bill to a third reading. The chair recognizes Mr. Michaelwitz of Boston.
Thank you, Mr. Speaker, and through to the members. Today we begin the debate on the House budget for FY22. And when I speak on the matter, I ask for a call of the yeas and nays, Mr. Speaker.
Mr. Michaelwitz moves when a vote be taken by a call of the yeas and nays. Those joining with them will rise. Monitors.
We have to excuse me. On the question on adoption to be engrossed, just want a clarification. We can order it to a third reading on a roll call, but is he asking? And then we vote on engrossment. We want the roll call. Engrossment.
Engrossment.
First division.
First division.
18.
Sufficient number having risen when a vote is ordered by a call of the yeas and nays. Chair recognizes Mr. Michaelwitz of Boston.
Thank you, Mr. Speaker, and through you to the members. As I stated, today we begin the debate on the House budget for FY22. Before I start, I want to take a moment to thank my staff, my incredible staff. I know that we all appreciate those that work in this building, but the work that the Ways and Means Committee, led by the Chief of Staff, Blake Weber, has done, the work that they have done over the past 15 months has been nothing short of remarkable. To start the FY21 process back in January of 2020, to then stop that operation in its tracks because of COVID, to wait and watch as we went month to month, not knowing when we were going to have to spring into action and produce a budget, then to finally complete an expedited process last fall that stretched over into the new year, and then, without the ability to catch our breath, to then start the process all over again for FY22 and help us get to us where we are today, is nothing short of remarkable, Mr. Speaker. I am very fortunate to have such a dedicated and determined group of people to prop us up and to try to make us look good here in the House. And even while things are still mostly remote, it has been critical to get us back on our regular timeline to give predictability to all in the Commonwealth that rely on the resources that this budget provides. Last November, when this House released its long-delayed FY21 budget, the end result was one that was appropriate to the times that we found ourselves in. There was less revenue available to us and a greater need for government to deliver more than ever before, creating challenging circumstances all around. Whether talking about housing stability, food security, education funding, or combating the growing concerns surrounding domestic violence and substance addiction, the budget we passed in the fall accomplished all of that. We did all this without making any drastic cuts, something I once again say was unthinkable when the pandemic first struck. Now, less than 5 months later, we still find ourselves in difficult times. Just as we did last fall, we in the House cannot shrink from our responsibilities on vital issues that our residents rely on each and every day. The budget proposal before you today does not shy away from those responsibilities. We will continue to prioritize people and the services they rely on. This budget does that while presenting a cautiously optimistic approach to the Commonwealth's fiscal picture. There has been promising news recently in terms of both vaccinations and the economic outlook. However, if the last year has taught us anything, it is to expect the unexpected and to be wary of false starts. We are beginning to see our way out of the COVID crisis, but we must remain cautious and focus on recovery and building a more equitable future for all our residents. Over the last year, the Commonwealth has been on a roller coaster-like ride in terms of its revenue projections. At the height of the pandemic, economists were predicting a revenue shortfall of as much as $6 billion, which would have had drastic effects across our entire budget. These dire predictions proved to be off the mark for a number of reasons. Our revenue picture has steadily improved, leading us to readjust our projections upwards several times over the last few months after reducing it in the fall of 2020. Now, 9 months into FY21, we find ourselves well above our benchmarks that we last revised in January, which is especially good news for our reserves. Our fiscal year 2022 budget relies on a stabilization fund withdrawal of $1.875 billion, which is certainly a large figure. However, as our economy continues to grow and recover from the last year, we are trending towards withdrawing considerably less out of the rainy day fund than we originally envisioned taking out in FY21, giving us some more flexibility in FY22. While this is encouraging news and bodes well for our economic outlook, we will have to see what the next few months bring before declaring any sort of victory on the fiscal year 2021. The $47.6 billion proposal before you for FY22 presents a well-balanced approach to the Commonwealth's needs. I want to thank all the members that took the time to meet with me and my staff, whether over Zoom or over the phone, to express your priorities and the direction you wanted to see the House move on these important challenges in front of us. This budget is a reflection of those discussions. It is a reflection of those priorities of the membership of the House. Starting with education, earlier this month, in order to give our municipalities some fiscal stability, the House and Senate Ways and Means Committees reached a local aid funding agreement. This agreement will provide certainty and predictability for our cities and towns and ensures we get back on schedule to fully implement the Student Opportunity Act. Among other things, this understanding fully funds 1/6 implementation of the SOA rates and creates a $40 million enrollment reserve fund targeted to stabilize school districts adversely impacted by pandemic-related enrollment fluctuation. All told, the House Ways and Means Committee recommends an overall investment of over $7.3 billion in local aid. This budget will also provide an additional $20 million to increase provider rates at early education centers across the Commonwealth, an area especially hit hard by this pandemic. Also, under the leadership of you, Mr. Speaker, one of the House's priorities is to continue to build back our economy and ensure that the Commonwealth comes out of this crisis in a stronger and more resilient manner. To ensure an equitable recovery, this budget focuses on economic growth and job training, with investments like $50 million for adult education, $24 million for youth work summer jobs, a new $5 million tourism marketing dollars that will help other parts of the country know that Massachusetts will be open for business as we attempt to restore our hospitality industry, and a new $10 million offshore wind energy career training program to help the Commonwealth continue to be a leader in this field. These programs and more will allow the Commonwealth to ensure that all our residents are able to take advantage of any future economic growth. In FY21, one of the main priorities of the House budget was in areas of housing and homelessness. This year will be no different, with programs like rental assistance for families in transition and the Massachusetts rental voucher programs funded at historically high levels. These investments will build off of the nearly $800 million in rental assistance the Commonwealth has received from the federal government since December. We also continue to prioritize food security with $43 million to both the emergency food assistance and the healthy incentive programs in order to ensure our most vulnerable population receive the help they need. The House remains committed to expanding treatment options and providing resources for those struggling with substance use and mental health issues. We have focused on prevention, intervention, and long-term recovery. The budget before you will invest $160 million into the Substance Use Disorder Trust Fund, allowing individuals across the addiction spectrum to access the services they need. The House has long been a leader in protecting reproductive rights, leading the way in past sessions by enacting the Roe Act, ending gender discrimination in disability insurance policies, and the Access Act, which ensured easy access to contraceptives. House Bill 4000 builds off of those past successes by funding a public education campaign to increase awareness for the Access Law, to continue to safeguard the health and well-being of all our residents. In conclusion, this budget continues the direction and focus of the FY21 budget by prioritizing our residents. As we cautiously recover from this pandemic and look towards the future, we must continue to build back a new normal, which is more resilient and equitable for everyone. We look forward to a healthy discussion of our priorities this week, and me and my staff look forward to working with all of you. I want to thank the gentle lady from Gloucester for all her help and support throughout these past few months, and the gentleman from Medford for his experience and his willingness to always step up and handle difficult circumstances. I want to thank my Republican colleagues, particularly the minority leader and the gentleman from Warren, the ranking member of this committee. Together we have navigated through difficult situations to the betterment of all our constituents, no matter what side of the aisle. Thank you to my Senate counterpart for his partnership, and I look forward to him and all his colleagues adopting everything we passed this week. And lastly, I want to thank you, Mr. Speaker, and your staff for your leadership and guidance. For many of us that have worked with you over the years, it has been a pleasure and a delight to watch you step into this new role and lead the House the way you have over the last couple months. Thank you, Mr. Speaker.
Chair recognizes Mr. Smoller of Warren.
Thank you, Mr. Speaker, and through you to the members. Mr. Speaker, I'd like to take this opportunity to congratulate you officially on your speakership here for your first full year shepherding a budget through this institution in not the easiest of circumstances. I want to thank all my colleagues here in the House who have been so gracious with their time as the Committee on Ways and Means has worked very diligently over the period of the last few weeks to conduct our hearings, and while be it a very unique way by comparison to what we're used to, but still affording individuals the opportunity to be able to express their concerns and to share their level of advocacy for various programs here in the Commonwealth that we hold so near and dear to our hearts. This is still very much a transitional budget. Transitional in the sense that we are dealing with the immediate challenges of the pandemic that is before us, but at the same time continuing to invest and build upon those programs that this institution and the people of this Commonwealth believe in. Investments in our local cities and towns, investments in programs that matter more now because of this pandemic than they ever have, including behavioral health situations that have so devastated many groups